Love Your Eyes is about being aware of and maintaining your own eye health. Start with these 4 P's. Prevent sight loss by adopting a healthy lifestyle. Protect your eyes from sunlight, accidents, and prolonged exposure to screens. Preserve your vision with regular eye examinations, and prioritize your eye health and that of your family and community. Nearly everyone on the planet will experience an eye health issue in their lifetime, and more than 1 billion people worldwide do not have access to eye care services. By 2050, half the world's population will be short-sighted. By strengthening health systems worldwide, we can reach those in need, because everyone counts. Love your eyes today and book an eye exam. Love Your Eyes is about being aware of and maintaining your own eye.
Hello, my name is Joanna and I'm the Director of Communications and Development at IAPB. Almost all of us on the planet will experience an eye health issue in our lifetime. Yet, more than 1 billion of us don't have access to eye care services. This is a global issue, but one that starts with us. This World Sight Day, our theme is Love Your Eyes. All focus on our own eye health, understand how important our eyes are to us and the value the job they do. We are thrilled to be announcing our most ambitious World Sight Day plans yet. This year, everyone counts. We're calling on everyone who can book a sight test, an exam or a screening to check on the well-being of their eyes. We want you to start thinking now how this September we can get over 1 million pairs of eyes tested by World Sight Day. It's no mean feat and we can't do it alone. We will be mobilising our members of the eye health sector and members of the public to pledge a test so that everyone can help contribute to this goal. So whether you're an individual, an eye care professional or organisation, everyone counts. Then, on World Sight Day, we will host a global challenge to unite all of us, bringing people across the globe together to have their eyes tested. We hope to remind the world that everyone counts and how important it is to take care of our own eye health, and to highlight the work still to be done in achieving access to everyone. Because Love Your Eyes loves children having the chance to reach their full potential, global economies boosted by increased productivity, older people who can participate fully in society, disadvantaged communities having greater access to vital eye care services. Eye care included in all health systems, workers supported by eye care initiatives in their workplace. So join us this year and love your eyes.
Blurry vision giving kids trouble? The pandemic hasn't helped. Get outside as often as possible. Have an arm's distance between eyes and books, and take 20-minute breaks from screens. Don't forget to get kids a sight test every 2 years. Love your eyes. Do you know the 20-20-20 rule for your eyes? Every 20 minutes, look away from and spend 20 seconds focusing on something 20 feet away. Share with a friend or coworker. Love your eyes. Do you
Love Your Eyes is about being aware of and maintaining your own eye health. Start with these 4 P's. Sight loss by adopting a healthy lifestyle. Protect your eyes from sunlight, accidents, and prolonged exposure to screens. Preserve your vision with regular eye examinations, and prioritize your eye health and that of your family and community. Nearly everyone on the planet will experience an eye health issue in their lifetime, and more than 1 billion people worldwide do not have access to eye care services. By 2050, half the world's population will be short-sighted. By strengthening health systems worldwide, we can reach those in need, because everyone counts. Love your eyes today and book an eye exam.
Hello, my name is Joanna and I am the Director of Communications and Development at IAPB. Almost all of us on the planet will experience an eye health issue in our lifetime. Yet, more than 1 billion of us don't have access to eye care services. This is a global issue, but one that starts with us. This World Sight Day, our theme is Love Your Eyes. To help us all focus on our own eye health, understand how important our eyes are to us and the value the job they do. We are thrilled to be announcing our most ambitious World Sight Day plans yet. This year, everyone counts. We're calling on everyone who can book a sight test, an exam or a screening to check on the well-being of their eyes. We want you to start thinking now how this September we can get over 1 million pairs of eyes tested by World Sight Day. It's no mean feat, and we can't do it alone. We will be mobilising our members, people across the eye health sector and members of the public to pledge a test so that everyone can help contribute to this goal. So whether you're an individual, an eye care professional or organisation, everyone counts. Then, on World Sight Day, we will host a global challenge to unite all of us, bringing people across the globe together to have their eyes tested. we hope to remind the world that everyone counts and how important it is to take care of our own eye health, and to highlight the work still to be done in achieving access to eye care services for everyone. Because Love Your Eyes loves children having the chance to reach their full potential, global economies boosted by increased productivity, older people who can participate fully in society, disadvantaged communities having greater access to vital eye care services. Eye care included in all health systems, workers supported by eye care initiatives in their workplace. So join us this year and love your eyes.
Blurry vision giving kids trouble? The pandemic hasn't helped. Get outside as often as possible. Have an arm's distance between eyes and books, and take 20-minute breaks from screens. Don't forget to get kids a sight test every 2 years. Love your eyes. Do you know the 20-20-20 rule for your eyes? Every 20 minutes, look away from the screen and spend 20 seconds focusing on something 20 feet away. Share with a friend or coworker. Love your eyes.
Yeah, good morning. Good morning, Doc Jojo.
Good morning.
Hi, Doc Noel. How are you doing?
Hello, Ma'am Cherry.
Hi.
Good morning,
Hi,
everyone.
Lillian. How are you?
Oh, I am in pink.
Wala ako makapit. Tachong pink lang kasi. Wala pang 1 year si Tom. Ayoko pa mag-ganyan. Tachong pink. I have something pink ng konti. You want me to change? Meron akong pink na pink.
Oh, well, you can.
Teka. Sige, try ko ah. Hindi pa naman nag-start, ano? Maaga pa. Kaya I still have time. Sige.
I can. Is my sound clear? Doc?
Clear.
Thank you. Ayan, we have how many minutes? We have 5 minutes to go.
Yeah, clear. Everyone here na ba? All the speakers, no?
I think so.
Yeah.
And pataas naman yung participants, so we can give a few more minutes siguro.
Oo, yeah.
Ayan, 80 na.
Are we heard already or not yet?
Yeah, yes.
Hello, Chris.
We can hear you well, Christine.
Good morning. Yeah. I just
Morning.
sent a chat to MC and Athena if it's all right to change my slide or we just need to put reference. Is that okay or
Yeah.
not yet? It's just a minor change.
Sana, is Athena here? I'm sure she should be here.
Hi, ma'am. You'll check, ma'am.
Ayan, pink na.
Wow.
Can you reply?
Di ba? Dapat campaign manager. Kaming dalawa ni Lynn.
Kahapon nga sa meeting namin with PGH, syempre nahihiya ako magsalita. But after the meeting, a doctor mentioned, sabi niya, I just want everyone to know that I am for Lenny. I'm so happy because I was so happy because everyone in the room were all clamoring for Lenny. So sabi ko, okay, I'm so happy.
Okay. So we have to be in pink every day.
Yeah. Bumili na ako ng marami.
Marami kong pink pero nasa Pasig. I have to go home to Pasig and get all the pink colors there para magamit ko.
Lions pa naman,
Love
red,
Your
diba?
Eyes is about being aware of
No,
and
no.
maintaining
It's
your
blue
own
and
eye health.
blue and yellow.
Star Peas.
Blue and yellow.
Prevent
Yeah,
sight loss
blue and
by
yellow.
adopting a healthy lifestyle.
Formerly violet and
Protect your
yellow.
eyes from sunlight,
Ngayon,
accidents,
blue and
and
yellow
prolonged
siya.
exposure to screens.
Pareho lang pala tayo sa Rotary. It's
Regular
blue
eye
and golden
examination.
yellow.
And
Halos para
prioritize
pagka service
your eye
organization
health and that
yata,
of your family
it follows
and
na yun ang
community.
color. Parang ganun ang
Everyone on the
Okay.
planet
But there are
will
some
lose an eye
lions
health issue in
who,
their
you know,
lifetime. And more than a
they
billion
change the
people
color of their
worldwide do not have
of their
access to eye
vest.
care services.
Pero
By
kami,
2050,
we maintain yung
half the world's
yung
population will be short-sighted.
blue and
Yellow and
yellow.
By strengthening health
Ma'am
systems
Cherry,
worldwide,
naka-pink
we
kayo,
can reach those in need.
Ba syempre, Lenny here.
Love your eyes today and welcome
Sige lang.
B.
Ang sa akin,
Gusto mo kanta
thank you,
kita?
Aling Vic.
Lenny B.
In support.
Kakanta
Pwede
kita.
naman blue and
Basta
pink.
Maleni lang kita. Kantahan kita.
Thank you po.
Love your eyes is about being aware of and being
Panahon na
health.
tama, Lenny B na tayo.
Oo. Panahon na para magsalita na.
Oo nga, ano na tayo. Labas na yan. Ganyan na talaga.
Hindi kasi noon nahihiya-hiya pa tayo no?
Eh paano ayaw pa niya mag-declare? Eh ngayon nag-declare na. Sige na.
Wow, we reached 100 already.
Hello, my name is Joanna and
Wow,
I'm the Director
nice.
of Communications and Development at IAPB.
Nangangalampag pa nga ako sa
Almost all
Lions.
of us
Lahat
on the planet
kinakalampag
will
ko sila eh.
experience an eye health issue in our lifetime. Yet, more than 1 billion of us don't have access to eye care services. This is a global issue, but one that starts with us.
Kasulatan ko naman
This
ng mga
website,
chairman ng mga
our
ibang
theme is
departments
Love
of
Your Eyes.
ophthalmology.
To help us all
So,
focus on our
both
own eye
private
health,
and public
understand how
training
important our
hospitals,
eyes are to
sinulatan
us,
ko lang
and
sila.
value the job they do.
So, we expect the residents
Medyo may
to join.
problema ako sa sa Lions because of the time.
This year,
Dahil
everyone
may mga hunger project
We're
sila.
calling on everyone
in-
to book a sight test, an exam, or a screening.
Kasi
to check on the
birthday ni
well-being
nung
of their
yung
eyes.
international president
And we've got
namin si
huge
Douglas
discussing now.
Alexander.
This
Yan ang
September, we can
they
get
have their
1,000 pairs of eyes
hunger
tested
projects
by
today.
World Sight Day.
Ngayong
Today.
umaga.
There's
Pero
no
kung
means,
naging gabi
and we
ito,
can't do it
kung
alone.
naging gabi ito,
We
we have
are
more
mobilizing
audience.
our members, people across
Oh.
the eye health
Umaga
sector,
kasabay ng
and members of
projects
the
nila.
public to play
So anyway,
the test so that
Ako din naman na
everyone
nag-farm
can
out nun
contribute
para
to this goal.
tumulong sila
Whether
at
you're an individual,
Oo nga.
an eye care professional, or
they have their
organization,
projects for today
everyone.
this morning. Eh,
Then, on World
nakasabay
Sight Day,
nitong
we
ating
will host a
webinar
global
sa
summit
World
to
Sight Day.
unite all of us,
Kasi ang lion sanay sa gabi. Yung talagang during the night time yung mga meetings. Kagabi nga hanggang 12 ako eh. O di ba? Kung muntik na akong di magising. Oras na. Ay nako. Anyway.
Kasi meron kang mga visits, no? Governor's visits.
Yeah. Kahit virtual, I have to do it. Pero ngayon, ang dami ng gusto face-to-face.
Tulungan mo ko paano.
Hirapan na ako. I have to go to Bataan. I have to go to Cabanatuan.
Sherry, ready na daw. Sherry, ready na daw.
Ready na? Okay. MC, ako din, I'll try to share my screen. Pero pag magkaroon ng glitch, MC, please be ready. But I will try to share my screen, ha? Thank you.
Okay.
Sige po.
Buti yung
Thank you.
gano'n.
Good morning, everyone. The program will start in 2 minutes.
Trouble. The pandemic hasn't helped. Get outside as often as possible. Have an arm's distance between eyes and books.
Yes po, Doc.
And take 20-minute breaks from screens.
Okay po.
Don't forget to get kids a sight test every 2 years. Love your eyes. Do you know the 20-20-20 rule for your eyes? Every 20 minutes, look away from the screen and spend 20 seconds focusing on something 20 feet away. Share with a friend or coworker. Love your eyes. Do you know the 20-20-20?
Good morning, everyone. Welcome to the World Sight Day 2021. With our theme, #Love Your Eyes. The Philippines joins the world to celebrate this day. Together with the whole eye health community worldwide, we are joining in the Everyone Counts Global Challenge. Ladies and gentlemen, the Philippine National Anthem.
Bayang magiliw, pelas ng sinanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupi, di ka pasisingin, sa dagat at bundok, sa simoy at sa langit mong bakaw, may nilagang tulad namin sa paglayang minamahal, ang isat ng matawat mo'y tagumpay na nagniningning, ang bituin
Let us put ourselves in the presence of our Almighty God. O Heavenly Father, you are all powerful, merciful, and loving. We acknowledge your presence today. We are thankful for all the blessings and protection you have given to us and our loved ones. Thank you for never leaving nor forsaking us in this pandemic. Lord, give us protection from all harm, guide us and give us the strength in all the challenges we are facing. Heal those who are sick and strengthen those who are weak. Strengthen also our faith in you. Father, forgive us from our sins. Cleanse our hearts and minds so we can be acceptable in your sight. Use us as an instrument for the betterment of our country and of the world. We entrust everything in your mighty hands. May we be steadfast in your word. We give you all the glory, honor, and praises. This is our prayer in the mighty name of Jesus. Amen.
Amen.
Hi, good morning, everyone. Welcome to the World Sight Day 2021 celebration via webinar. So for this morning, I am your MC and your moderator. Allow me to introduce myself. I am District Governor Cherry Meneses of District 301D2 Lions Clubs International. Also the Corporate Secretary of the Tangal Catarata Foundation, the Chairperson for Community Service, the co-organizer, that's together with my late husband Tom Meneses, and the team coordinator of Pasig Host Eye Surgical Team. So again, welcome dear participants and our distinguished guests and distinguished speakers for this morning. World Sight Day is celebrated every 14th day of October. World Sight Day is being aware of your own eye health. That means we have to get our vision screened or simply have our eye checked up and recommend others to do the same. So the Philippine Eye Research Institute or PERI and the National Committee for Sight Preservation, member organization, partners with the Department of Health in supporting the International Agency for the Prevention of Blindness regarding the celebration of World Sight Day, particularly this World Sight Day 2021. With the stakeholders' emphasis that everybody counts. That means global and national challenge. And this is, having, this hashtag love your eyes, maging matalino, and ambitious campaign to encourage everyone to get their vision screened or tested. So before we get started, of course, we need some welcome remarks from a very dear person, Dr. Noel Chua. Dr. Chua is currently the chairman of the National Committee for Sight Preservation. NCSP, or the National Committee for Sight Preservation, is a coalition of organizations committed to the preservation of sight through partnership, technical expertise, directions for national program and development, and resource investment. Dr. Chua previously heads the Eye Institute of St. Luke's Medical Center, both in Quezon City and Global City, and an associate professor at the University of the East, Ramon Magsaysay. He received a Regional Achievement Award for his distinguished service to Global Initiative to Reduce Avoidable Blindness from the International Agency for the Prevention of Blindness. Dr. Noel, the virtual floor is yours.
Thank you, Cherry. Good morning to our esteemed panelists and to everyone online. The National Committee for Sight Preservation is a coalition of eye care stakeholders working with the Department of Health in the implementation of the National Prevention of Blindness Program. NCSP, in partnership with Novartis, welcome you all to this online Everyone Counts, a global and national challenge. Today, October 14, 2021, is World Sight Day with the theme, Love Your Eyes. We are aware that everyone in this planet will experience eye health issues in our lifetime. Today, here in the Philippines and globally, the Love Your Eyes reminds us to actively take care of our own eye health by having an eye test and proactively recommend to others to do the same. This campaign, initiated by the International Agency for the Prevention of Blindness, hopes, with the help of the international eye care stakeholders, to encourage everyone to get their vision or eyes screened or tested with a workable target of 1 million. Everyone counts. This campaign is in consonance and with a continuation of our own advocacy, Maging Matalino, Magpa-check up, now na, initiated during our August Sight Saving Month. This campaign was initiated in collaboration with Novartis, part of the international program Collaboration to Preserve Sight. The advocacy message is that everyone has a personal responsibility for one's own eye health through early eye consult. With the COVID-19 lockdown and health precautions, our partner eye care stakeholders continue to resort to teleconsult, eye screening, infographics, webinars, and is consultation only when the eye condition warrants it. The different topics of this online seminar will help guide you on how to do vision screening as a primary eye care model, assist you in knowing what conditions can be managed at home and those that need special eye examination, immediate treatment, and finally, to whom you can turn to for support. This is by Dr. Leo Cobillan. The topic will transition to how eye care delivery and referral services in urban and rural settings from Dr. Cadil Sinulinding, and eye care management for children from a pediatric ophthalmologist, Dr. Carlos Chua, and finally, the vital role of the private sectors and NGOs on how they support eye care services by Lynn Abanilla. The overarching message is for each and everyone to have an eye consult, as it is everyone's responsibility to take care of one's own. Let us accept the challenge and be counted and be part of the millions screened or checked. Thank you. Have a clear and bright day ahead.
Oh, thank you so much, Dr. Chua. So everyone, we have listened to his welcome message. The challenge is on. Have your eyes check up now na. Okay. So for our first speaker, we will hear from Dr. Leo Cobillan. Dr. Leo Cobillan is the current director of the Philippine Eye Research Institute, or PERI, of the National Institute of Health at the University of the Philippines. He spearheads various eye health projects and policies for the prevention of blindness and improvement of eye care among Filipinos. His major achievement and accomplishment, in collaboration with the Department of Health and the Department of Education, is about the policy development of the National Vision Screening Program, or the NVSP, for the kindergarten pupils. The National Vision Screening Program aims to detect and prevent vision impairment and blindness among children. This policy was signed into law last July 31, 2019, otherwise known as the Republic Act 11358. And with its relevance to the nation's health delivery system, he has been earlier recognized with the 2017 Alberto Romualdez Jr. Outstanding Health Research Award in the Health Services Research category. He took his undergraduate studies in the University of the Philippines, Diliman, BS Biology. He finished his medical degree from the University of the Philippines, Manila College of Medicine, and obtained his master's degree in public health, major in epidemiology from the University of California. He then completed his residency in ophthalmology at the Philippine General Hospital and his fellowship on cornea, uveitis, and external eye diseases at the University of California, San Francisco. Dr. Leo will discuss vision screening, blindness prevention and primary eye care towards universal health care. Dr. Leo, the virtual floor is yours.
Thank you for the introduction. Magandang umaga sa lahat ng nakikinig dito sa webinar, World Sight Day 2021, Philippines edition. For this morning, I'd like to share with you the National Vision Screening Program of the Philippines. We also have the online remote vision screening, which we developed during this pandemic period. There are also other blindness prevention programs, the Philippine Eye Disease Prevalence Study, the myopia and EOR in the Philippines, the retinopathy of prematurity screening, as well as the primary eye care program, the Rural Health Unit module. These programs will be part of the bigger DOH program on universal healthcare, kalusugan at kalinga para sa lahat. You are familiar with this Snellen chart, which the eye care practitioner would use to test your vision. If you can read the 8th line, the letters above the red line, that means you're normal. What a normal person can see at 20 feet or 6 meters, you can also see. Now, when you apply for a driver's license, you're allowed to drive if you can read the 5th line, that's 20/40. Now, the World Health Organization defines that you have no visual impairment or visual impairment if you can see line 4 or better. Now, if you can only read the first 3 lines, you're considered visually impaired. If you can only read the first line of Snellen, the letter E, then you are considered legally blind. That's part of the Philippine law. Now, the WHO defines that you are WHO blind if you can only count fingers less than 3 meters. We looked at the different screening from infancy to the older age group to see which of this screening method we could do for the entire population, cost effective, and which one would benefit and which would prevent blindness. We zeroed in to the population vision screening of kindergarten pupils, those less than 7 years of age, because when you see error refraction or amblyopia or lazy eye, then you can still treat. So we worked on this with the Department of Health and the Department of Education to form the National Vision Screening Program with the Senate and the Congress. And in July 23, 2018, Republic Act 11358 was signed into law an act establishing the National Vision Screening Program for kindergarten pupils. This is a mandatory screening of all pupils entering the Filipino school system age 5 or 6 to detect error of refraction and amblyopia. We train teachers to do this screening. They do this once a year among kindergarten pupils at the same time when they measure the weight and the height of these children. They use the PeriVision screening kit, which uses the Leia symbols chart. No? It's a universal symbol because at this age, they may not be able to read letters or numbers. And if this is a pass-fail system, which can be done in 2 to 3 minutes, and if they fail in this screening test, we label this as FR or front row kids. So because the immediate intervention for this program is that they will be placed in the front row of the class so they could see the blackboard, and hopefully it will improve in their learning immediately while waiting for the referral to the eye care practitioner for them to be screened, tested for error of refraction and amblyopia. Now, over the course, the last few years, when there was still face-to-face class, we were able to do the initial implementation of this program in several parts of the country. And with this, we were able to see that around 4 out of 40 children in a class would have error of refraction or amblyopia. In a class among 4 students with this condition who would fail the test, 1 would have amblyopia and 3 would have error of refraction, amblyopia or lazy eye. Now, during the pandemic period where there are no face-to-face class, we were looking into an online vision screening. There are actually commercially available online vision screening tools such as this, Go Check Kids. But because we wanted it as a bridging program for the national vision screening in this country, so we developed our own online vision screening process, which was introduced on World Sight Day in October 8, 2020, that was last year. So this program involves a trained screener in an area such as the Philippine Eye Research Institute, and at the homes of these children where there's a remote screen sharing, we use different apps such as Messenger, since most of the parents would have Messenger, or Zoom or Viber. Then it involves calibration of the screen because they would have different devices, tablets or cell phone, and training for the mother. We let them choose which of the images the same size as that of the ruler, 1 centimeter mark on the ruler. Then we practice the parents. The kid should be placed 3 meters away from the screen. Then we screen 1 eye at a time. Then if they fail in the test, we tell the parents that they are considered front row kids. So that means when there's face-to-face class, they are advised to be in the front rows of the class so they could see the blackboard. Or if there's time, if quarantine allows them to go to see an eye care practitioner, they be seen so that they can be given eyeglasses, or if they have lazy eye or amblyopia, they would be treated. Now, there are other blindness prevention programs that we have. One is we looked at the prevalence of the Philippine eye diseases. And in 2018, we saw that the national prevalence of visual impairment is 1.98%. The major cause of visual impairment includes cataract, that's the number 1, with 1.1 million Filipinos affected and around 333,000 requiring surgery. Now, there are 398,000 Filipinos with uncorrected error of refraction, so they have visual impairment, but actually with just eyeglasses, they could actually see, and around 283,000 with glaucoma, and 200,000 with diabetic retinopathy or maculopathy. Now, among those patients with no complaint of blurring of vision, they have no visual impairment. When we examine this population, there are actually around 700,000 Filipinos with glaucoma and 600,000 Filipinos with diabetic retinopathy, which shows that we need to screen population vulnerable to eye diseases. And as an example, if they are diagnosed with diabetes, they have to be screened for diabetic retinopathy. When we look at the error of refraction prevalence in the Philippines, the error of refraction, the prevalence in kindergarten is around 8.9%, and it increased to 16% in high school. And 90% would be myopia or nearsightedness. And when we compare this 10 years ago, there's increasing in prevalence. In fact, when we look at the prevalence worldwide, it's been increased several years. And we know that there are complications of high myopia that can cause blindness. So in fact, the World Health Organization looked into this, and over the last several years, there have been studies saying that outdoor exposure may reduce myopia progression. There was a big study where they looked at Singaporean in Singapore and Singaporean living in Australia. And with the same age group, those in Australia have less progression of myopia. And this could be because they were able to associate it with the educational curriculum where there's more outdoor exposure in Australia compared to Singapore. Now, the Philippine Eye Health Summit in 2019 was held with as a program of the WHO and the different stakeholders of eye health in this country, including the Philippine Eye Research Institute, and the focus was on myopia. And during this summit, we were able to get a statement of support from the DepEd to allot 1 additional hour daily of different outdoor activities for kindergarten pupils and in the elementary school. This is in addition to the 1 hour outdoor activity they already have. And the DOH also looked into the possible provision of prescription eyeglasses. The WHO was working into making prescription eyeglasses a medical device so it can be covered by the healthcare system, in our case, the PhilHealth. So hopefully they will cover the eyeglasses of kindergarten pupils as well as those in elementary school. Now, for increasing in outdoor exposure, the recommendation is 3 hours per day or 15 hours per week. In Singapore and in Taiwan, they use a monitoring device like a bracelet where it captures the number of hours outdoor, and it's similar actually to the tracker we have, the step counter we have. Now, there are other cases which can cause blindness. In this case, among premature infants, where they have problems in the back part of the eye or the retina. They develop retinopathy of prematurity. And when we looked at the blind schools in the country, ROP is the most common listed cause of blindness, around 47.6% among schools in the resources for the blind and 20.8% among schools in the Philippine National School for the Blind. Now, because of this, the WHO, the Department of Health, with the Philippine Eye Research Institute, helped in formulating the ROP guidelines. For this, the newborns who meet the following criteria should undergo screening for ROP, less than or equal 30 to 32 weeks of age, or less than or equal to 1,500 grams of weight, or preterm, greater than 32 weeks, but with risk factors as determined by the pediatrician or neonatologist. Usually it's sepsis, and the timing of initial examination is 20 days after birth or before discharge, whichever is earlier. So to be able to detect those with retinopathy of prematurity. So in some cases, early treatment would prevent blindness among these children. Now, although we have these different blindness prevention programs that are already in place, we have those that are currently under study. One is an ongoing project, the diabetic retinopathy and artificial intelligence, because there are not enough eye doctors who can screen diabetic retinopathy among patients with diabetes. So this project was developed. This is a remote diabetic retinopathy screening using artificial intelligence. On September 21, 2021, recently, Perry Reach, headed by Dr. Silva, shared the first successful implementation of a validated artificial intelligence in the clinical setting for ophthalmology in the country. The goal is that in the future, a person can go to the mall, those with diabetes, and have their eyes checked, and it will tell them if they need to visit an eye doctor for a full examination of the retina for a past. Also, on an early stage, we have we're developing a glaucoma screening using virtual reality. This is one of the modalities. It's still in the early stage. So if this will determine if a person should, go see an eye doctor to be screened for glaucoma. Now, for primary eye care program, the Rural Health Unit module, this is part of the Community Eye Health Program of DOH. In communities, the first person that the health care worker that they encounter would be the barangay health workers. Then they go to the rural health units before they are referred to the provincial or district hospital or to a subspecialty hospital, in our case, the regional eye center. And for these rural health units, the Philippine Eye Research Institute with the Department of Health developed this primary eye care guide where we have the different eye diseases grouped into, like, for blurring of vision, eye injury or trauma, red eye infection and mass, and also areas where they could do routine screening. And on the right side, when they see the disease, it has the description of the disease because these are for primary practitioners. So they would know which of these diseases they can actually treat and before referring, or which one they can screen and refer, or which of these diseases that require immediate referral. And for routine screening, it includes the retinopathy of prematurity, screening for premature infants, and then also the vision screening for kindergarten, as well as some grades of elementary school. Also the screening for diabetic retinopathy for those diagnosed with diabetes, and vision screening for the elderly. Now, all of these form part of the Universal Healthcare Program, so hopefully, which will be implemented by DOH soon. The Universal Healthcare Program, Kalusugan Pangkalahatan, is a provision to every Filipino of the highest possible quality of healthcare that is accessible, efficient, equitably distributively funded, fairly financed, and appropriately used by an informed and empowered public. The Philippine Eye Research Institute also supports the United Nations Sustainable Development Goals. So most of our researches are focused on these programs. Thank you for your time and good morning.
Oh, naku, napakaganda ng presentation ni Dr. Cobillan. Mabuhay po ang Philippine Eye Research Institute sa inyong mga ginagawang mga hakbang towards eye care. Particularly, knowing that 90% of our Filipinos are already myopic, and high myopia can cause blindness. Imagine that. So that's how important for us to get our eye check-up. Kaya tama yung campaign ng IAPB, ng ating International Agency for the Prevention of Blindness. Have your eye check-up now na. Okay, so for our next speaker, we have Dr. Cadil Sinulunding. Dr. Jojo, as we fondly call him, is currently the Chief Executive Officer and founder of Dr. Shahid Deseret Ambulatory Referral Center, and the Vision 2020 Cataract Charities Project. Dr. Cadil is a progressive ophthalmologist, public health and nutrition advocate, hospital manager, and a community organizer. A national and international awardee in various fields of in medicine. To make mention, the Jose Rizal Award for Outstanding Physician by the Philippine Medical Association, one of the 10 Outstanding Young Men Awardee for Rural Medicine, Heidi Yorak Awardee by the University of the Philippines for his leadership and volunteerism, among others. He is a proud member of the Philippine Academy of Ophthalmology and the International Society of Manual Small Incision Cataract Surgery. He worked his way serving the Philippines Autonomous Region in Muslim Mindanao as Secretary of Health and Regional Nutrition Program Coordinator for 9 years. He also heads the Office of the National Nutrition Council of Bangsamoro Region. Dr. Cadil Sinulingbing will share with us eye care delivery and referral system, referral services in the urban and rural settings. Dr. Jojo, you may have the virtual floor.
Thank you so much, Ma'am Cherry. I'm going to share now my presentation, and I hope everybody can hear me loud and clear. Participants, speakers, organizers, Assalamu alaikum, greetings of peace, good morning. Today marks another milestone in our delivery of basic services, the primary eye care, to optometry services, and finally, to ophthalmic interventions. May I dedicate this lecture to Dr. Eva Santos, the mother of Philippine Community Ophthalmology, and also to Dr. Rosie Noche. Understanding the cataract management give us idea how blindness data is utilized and interpreted. Globally, back in 2002, we have about 50 million cases of blindness due to cataract. That's prevalence rate, or simply our cataract backlog. Yearly, there are about 6 to 10 million new cases coming into the picture, otherwise known as the incidence. This number represents people that wait surgical intervention done in our hospitals and eye centers. The number of surgery performed per million cases represents the cataract surgical rate, as you can see in the picture. Back then in 1996, I remember during our workshop with Dr. Alan Foster, the Philippines CSR was estimated to be close to about 800. With 1 million surgeries against billion population in 2002, I can say that our CSR is way, way down below. A report of WHO in 2017 stated that there are about 289 million visually impaired and 39 million bilateral blind. Most of them live in poorer communities whose blindness are treatable and can be prevented. Comparing the 2002 and 2017 Philippine blindness data, there is a significant reduction of blindness due to cataract as shown. You can see from 460,000 to 332,000. What could be the reason for the decrease? Actually, the increase in the number of surgeries performed, increasing our CSR each year. Thank you, eye doctors, and also PhilHealth for paying. What worries me here is the 2.1 million bilateral low vision, and almost half actually is due to cataract. With the increasing number of ophthalmologists each year, the ratio with population also increases. However, sad to say, the most ophthalmologists have a practice in the private sector, and most of them are in the urban areas. I remember the various employed and activities included, causing clamor for serious change in the policies and guidelines of the Philippine Academy of Ophthalmology as an organization and PhilHealth as financial institution towards eye missions, community screening, volume surgeries, and respect of IMD territories. At the end of the day, the words misuse, overuse, abuse became so popular in the circle of ophthalmologists. Despite the strategies done, still more and more work needs to be done to cope with the cataract backlog alone. In 1995, we started dreaming about a better seeing country with our 2020. The right to sight with the slogan, "Together we can achieve." Let's ask ourselves, have we? Then why did we fail if others feel that? There is actually a long list of reasons, but the main one rests on our shoulders. Have we shared fair enough? Or simply keep whining while the country plunges into darkness? Among all reasons, be reminded that only ophthalmologists can perform cataract surgery. It is really in our hands now. Yet, we have intention of giving up the fight. Let me share some of the pointers and reminder and possibly an eye opener. In this campaign, we need a leader. But then who? Is it the DOH? Is it the Philippine Academy of Ophthalmology or the National Committee on Sight Preservation or NGOs? A simple and clear message to the public that eye services are available, effective, and affordable must be done. We all know that there are no exotic approach or magical solution to cataract blindness due to errors of refraction. It is just hard work and pure dedication to serve. In my facility, I can charge to as high as 35,000 per eye or to absolutely free. May libre pang sundo and hatid for the serving patients. We need community volunteers as responders. If we intend to address cataract backlog, putting quality number above the word premium in our surgeries. Lastly, as everybody pours in their share, the PhilHealth must support the campaign by removing the surgical cap or encouraging more surgeries, especially among the poorer sector, and penalizing abusive and fraudulent physicians. In 1995, I started organizing a community-based project traveling from Cotabato to Tawi-Tawi to as far as Cagayan Valley and Ilocos Norte. We received recognitions and awards from local and international bodies, but that is not important. What is more important is the word thank you from the people that we serve. The Vision 2020 Cataract Charities Project, with partnership to national and international NGOs, we perform about at least 1,500 cataract surgeries a year until joining DOH arm in 2010. Because of eye missions, some praised us. Some sadly hated us. But it has encouraged many eye doctors to do more surgeries in their turf. To date, I'm still doing about 100 a month, paid or not. With the right information disseminated, where will the blind patient go? Either to a world-class facility in our locality, or we fondly say, Muhammad, peace be upon him, goes to the mountain. Or the surgical team goes to the community and serve just as the mountain goes to Prophet Muhammad, peace be upon him. You can either do it in the best equipped hospital or in the most innovative way just to serve, and then the reward can be very heartwarming and satisfying. Let me share the story of Babu Amina. She is a 60-year-old blind for 19 years. She has never seen a doctor, and I was the first in her lifetime, she said. Despite the fear of surgery, her desperate status compelled her to endure the 30-minute bilateral cataract surgery. Right after the surgery, she cried and said, "The last time I saw my son," you can see in yellow shirt below, he was only 9 years old. Now he has a 9-year-old. That is the boy standing beside his father, the one in blue shirt in the lowest picture. This tear-jerking event happened in a 6th-class municipality of Turtle Islands in Tawi-Tawi and is known as the home to the Philippine Green Sea and Hawksbill turtles, and there are more than 2 people. Despite the lack of hospital or health center, the school classroom serves a makeshift operating theater, manned by 3 vigilant assistants, the ophthalmic nurse, the circulating nurse, and the third one, tigbugaw ng langaw, because it was really in the open. Let's do the math here. With 1,032,000 people with cataract, the Filipino eye doctor can still eradicate the backlog by doing this number of surgeries per month. Parang monthly amortization lang ng sasakyan. The choice is yours. 2 years ba with 28 surgeries a month? Or 3 years with 18 surgeries a month? And with the 6.8 billion we spent on face masks and face shields, it is enough to treat 425,000 eyes with cataract. How do we do it? Ladies and gentlemen, let us do the extra mile. Either you go to the patients by way of car, by boat, you hike, or even wade in the flood waters during peacetime or during strife with a single motive: let us serve our people. People ask me if I can do or I do bilateral cataract surgery. My answer really is very clear. It is yes, for a reason, and usually in places where there are no eye doctors, and I know I cannot come sooner. And they ask again, how many surgeries can we do in a day? With good team of eye doctors, nurses, and support staff that makes our work efficient, effective, and systematic, I replied, depends on how many patients came in for the surgery. So depende po kung ano po ang dami ng dumadating, and an efficient team can really make a lot of difference. Remember, kindness must spread like a virus, as it touches the heart and penetrates the mind of the people we care to serve. Thank you very much for listening, and good luck to my friend Mingita. Remember, I am always with you with your plans. Wabillahi taufiq wal hidayah. Wassalamu alaikum warahmatullahi ta'ala wa barakatuhu. Greetings of peace from the southernmost region of the country, the Bangsamoro Autonomous Region. Thank you so much.
Wow, thank you so much, Dr. Jojo Cadil Sinulingding. You are really very inspiring, and I can fully relate to you. You were once and still my partner in restoration of vision. And you know that, guys, and everyone here is still with our call to our eye doctors to do their fair share. Eye doctors, wake up. That is the challenge of our dear Dr. Cadil Sinulinding. Thank you very much, Dr. Jojo. Okay, for our next speaker, we have Dr. Carlos Emmanuel Chua. Dr. Carlos Emmanuel Chua is a graduate of the University of Santo Tomas and obtained this residency at the St. Luke's Medical Center International Eye Institute. He completed his fellowship training in pediatric ophthalmology and strabismus in Alberta Children's Hospital. He is a diplomate in the Philippine Board of Ophthalmology and an active consultant at the St. Luke's Medical Center, both in Quezon City and Global City. He is currently the president of the Philippine Society of Pediatric Ophthalmology and Strabismus. Ladies and gentlemen, we will present to you Dr. Chua, who will discuss on eye care management for children. Dr. Carlos Chua, you may have the virtual floor.
Thank you so much. So let me just share my slide. Can everybody see my slides? Hello, can everybody see my slides?
Yes, Dr. Yes, Dr. Chua.
All right. All right. So thank you to the NCSP for inviting me to talk about pediatric eye care in the time of the pandemic. Let me just, sorry. Okay. So prior to the pandemic, how was pediatric eye care? So prior to the pandemic, we had face-to-face visits, we had school visits, we had medical missions, and the Philippine Society of Pediatric Ophthalmology and Strabismus had a program called Myopia Prevention or Labas Laro Tayo. Kabataan maglaro sa araw upang manatiling malinaw. During this program, we were encouraging children to stay outside to prevent myopia progression. Like what Leo said a while ago, myopia is a very big problem, especially here in Asia. And the biggest problem actually is because we are using our screens too often, or we are reading too much. So it's also partly genetic, it's partly environmental. And like he said, in Australia, there were studies that said that as long as you played outside, your myopia progression would become less. So we actually started doing visual pathways. This was under the auspices of Dr. Patty Villa as a president in 2019. We actually tied up already with a public school and we made a visual pathway so that during recess and lunch, the children could actually play outdoors. We actually already had a program that we were going to do a visual pathway in Rizal Park as well. Pero of course, the pandemic hit. So all of this was stopped. So what can we tell our parents now that we are online more often? Now, as we all know, online classes are still ongoing. Children still can't go out. And again, there's less socialization going on because all children are just indoors. They're always just staring at their screens. They're just watching TV. They're just playing their computers. So as a program, because we couldn't ask our kids to go out, what the Philippine Society of Pediatric Ophthalmology and Strabismus did was we actually did a digital healthcare program. So we actively used the Facebook, Instagram, and Twitter accounts to promote digital eye health. So when you go to our Facebook account, you will actually see almost every week we will have a new infographic discussing different eye diseases. So like here, we're talking about refraction or grado ng mata, tsaka kung kailangan magsuot palagi ng salamin. There are other infographics about sore eyes, about kuliti, about duling, banlag, retinoblastoma. And actually, our interaction with parents is very high this way because now everybody's just using their phones and they learn a lot actually from all these infographics. Also, we translated our infographics into different local dialects as well. So the nice thing with this is we are now, expanding our horizons to the different other regions. So, like you can see here, may ara na in Ilonggo, no, and there's another one also in Pampangueño. So you can see that it's quite interactive and people will understand it quite easier. So, as you can see, we have recommended screen times now. So, Doc, bakit kailangan yung recommended screen times? Well, especially now that it's the pandemic, we really want to tell the parents to guide their kids about the amount of screen time that their children should have. And the Philippine Society of Pediatric Ophthalmology and Strabismus suggests that if your child is 1 year old or less, you should not actually have any screen time. They should not spend time on digital devices. You should actually have active socialization with your child. You want to be talking to them. You want to be using your flashcards. You want to be going at least outside your doors, getting some sunlight so that they have quality time with the parents. If the child is now 2 years old, we suggest that they only have less than 1 hour per day. And then the shows that they should watch should have adult supervision. Ayaw natin na kung ano-ano na lang ang bubukas mo sa TV at papanoorin ng mga bata. Gusto mo, nakikita ninyo kung ano ang pinapanood ng mga anak ninyo. Pag 3 to 4 years of age, gusto pa rin namin ng less than 1 hour per day. Pero ngayon, gusto namin magkatabi kayo pag nanonood kayo ng show, ng TV, pag nanonood siya ng YouTube. Bakit? Para masabihan niyo siya kung tama o mali ang ginagawa ng mga pinapanood nila. We also want to encourage interactive play. So kung meron kayong mga family computer, Xbox, PlayStation, no? Gusto natin maglaro kasama nila. So you want to have those sports games na kayong dalawa ay naglalaro together para may interaction kayo. Now, at 5 years of age, actually, we already suggest guided screen time. So actually, wala nang set hour of screen time because these children are already studying. Nag-online na tayo, nagmo-modules na tayo, asynchronous tayo. So hindi naman pwedeng walang screen time ang mga batang to. But during the breaks, you want them to take breaks. And what they are watching, what they are looking at should still be monitored. Why is too much screen time bad ba? Why is it important to actually limit our screen time? Because, well, according to the Mayo Health System, no, the most common bad thing about having too much screen time is we actually promote obesity. Children will actually be just sitting on the table, sitting on their chairs, lying in bed, not going outside. So they don't have the physical activity that we want these children to have. The irregular sleep patterns will also occur. Why? Because they're watching until 12 midnight, 1 o'clock, 2 o'clock, no? And this is actually overstimulating their brains. They may also start developing behavioral problems. Bakit? Kasi kung nanonood sila ng TikTok, nagpo-post sila sa Facebook, nagpo-post sila sa Instagram, gusto nila yung likes na tinatawag natin. Paano kung hindi sila binibigyan ng likes? Paano kung maraming bad comments? So syempre nagkakaroon ngayon sila ng emotional at social problems. They will be attention seeking as well. And these are problems that we have to address when they're young, or we prevent it from happening by monitoring what they're doing. They can also have impaired academic performance because I get patients in the clinic saying, Doc, they're not listening to teacher. They're just playing Clash of Clans, no? Kung ano-ano na yung nilalaro nila, hindi na sila nakikinig. So you want to limit their screen time when they are actually in school. It can also promote violence because of the shows they're watching. There's less time for outdoor play. And of course, eye strain. Bakit eye strain? Kasi ayaw na nilang huminto, tumingin sa screen. Gusto lang nila tingnan palagi. So how do we reduce our screen time? What do we suggest? How can we reduce our screen time? We want to eliminate background TV. So, Doc, ano yung background TV? Kasi ayaw natin ng distraction. Di ba tayo ngayon sa bahay, dahil nasa bahay lang tayo, gusto natin nakabukas lang ng TV para may naririnig tayo. Naririnig mo yung news, naririnig mo yung kantahan. Pero actually, you want to eliminate this because this is actually stimulating to the children. Another thing you want to do is to keep the TV, smartphones, and computers out of the bedroom as well. We want them so that we can actually monitor what our children are watching or looking at. No? We also don't want you and their children to eat in front of a screen. Bakit? Because pag nanonood ka lang, abot ka lang ng abot sa lamesa, kain ka lang ng kain, ayaw ho natin gawin yun. No? It increases kasi the children's total screen time. And we want to set a good example. Pinagbabawalan nyo yung anak nyong mag-cellphone sa lamesa, pero kayo, nagsi-cellphone kayo sa lamesa. No? Nagchat-chat kayo sa lamesa. Kapag sinabi nyo sa anak nyo na bawal, kayo rin dapat bawal. So when your child does have screen time, you want to plan what your child views. So ang maganda ngayon sa YouTube, pwede kayo magpili lang ng shows na gusto ninyo. You can actually download shows as well. So you want quality. You can get rid actually of all the commercials. You just let them watch the show itself. No? Another thing you can do is you can actually just approve the apps that they download. Minsan kasi binibigay nyo yung cellphone nyo sa anak nyo, wala nang parental approval. So kahit anong app na lang, pwede nilang i-download. So kahit na TikTok na pang 3 taon, pwede nilang i-download. Sila na mismo nagtitiktok, sila na nanonood ng mga nagtitiktok. So at least nababantayan ninyo kung ano yung nasa phone nyo. No? You want to watch with your child as well. You want to talk about the show, you want to talk about what's happening para they understand that that's only in TV, that's not real life. That's not how I treat my friends, my children. No? You can also record programs and watch them later, and you want to encourage active screen time. Ano, Doc, yung active screen time? So kunyari, nanonood kayo ng sabay, tapos nagka-commercial, o laro tayo ng game, o sino yung may pinakamaraming jumping jacks na magagawa bago mag-start yung show ulit, mananalo, bibigyan kita ng prize. So these are active games that you can do in between, and this actually encourages socialization amongst all of you. No? And then you can also, again, choose games on the family computer, on your game computer games that can actually promote running, physical activity. So how do we prevent digital eye strain? So the Philippine Society of Pediatric Ophthalmology and Strabismus again came out with this infographic about digital eye strain. And digital eye strain is actually presents with dry eyes, blurring vision, watery eyes, and headaches. And how do we prevent this? So the most important thing, especially now that we're online all the time, is to have proper posture and to be not too close to your screens. So as you can see over here in the 2 photographs, we don't want a child to be hunching down over their computers. We don't want their necks to be always down. We don't want them to be nakatungo palagi. So gusto mo actually yung screen mo is level with his eyes. Hindi siya mas mababa sa eyes ng bata para hindi sila nag-hunch. Second, you want to actually have 18 to 24 inches distance between your eyes to your screen para you prevent the digital eye strain. The second is we want to have bigger fonts and lower screen brightness. Ngayon po, hindi naman ho lahat ng bata ay merong computer kapag nag-online or pag nagmo-module. So minsan naka-cellphone lang po kayo, nasa labas pa kayo, maliwanag pa masyado kasi nandun lang yung signal. So ang gusto natin gawin is lakihan natin yung font ng computer, ng cellphone screen or ng tablet para hindi mahirapan yung bata. Kasi kapag masyado maliit, nagpipilit kang magbasa ng module or ng text ng teacher ninyo sa maliit na screen, mahihirapan, masistrain yung eyes ng bata. So gusto natin lakihan yung front. Pangalawa, kung nasa loob kayo ng bahay, ayaw mo naman ng 100% brightness. Masyado yan maliwanag. Yung glare will actually be causing, again, digital eye strain. So you want to bring down the brightness of your screen as well. We want our screen brightness to be anywhere from 30 to 70%. Third, like you were hearing from the commercial a while ago before this whole thing started, we want you to follow the 20-20-20 rule, and we want you to blink regularly, or we want our children to blink regularly. So you can actually download a lot of apps, no? Sa Android, sa Apple, sa Windows computer. May mga apps po kayong mada-download na 20, 20, 20. At ang nangyayari ho dito, kada 20 minuto, tutunog siya. Hindi naman ho masyado malakas. Medyo mag-chime lang siya. Ting, gano'n. Tapos pag narinig ng bata yon, ang gagawin ng bata is pipikit, bibilang ng 20. So pag pikit ng bata, bilang 1, 2, 3, 4, 5, 6, 7, 8, 20. O pag dilat nila, na-relax na nila ng konti yung eyes nila, nag-blink na sila ng konti, na-moisturize na nila yung eyes nila ng konti, they can start using their computers screens again. Now, it's called 20-20-20 because you want to look 20 feet away. But sometimes kasi you're inside a room and the window is behind you. Ayaw naman ng mga bata lumingon pa. Kaya okay lang sa akin na pumikit. Pero kung kayang tumingin sa labas, better. Bakit? Kasi kapag nakatingin kayo sa screen, lagi kayong naka-flex, no? Laging naka-strain yung eyes na nakatingin sa malapit. Ang gusto mo actually i-stretch, iunat ng konti yung mga mata. Kaya gusto natin ipatingin sa malayo para mas ma-relax yung kanilang mga mata. And lastly, we don't want the fan or aircon to hit their face. And if it is dry, if they complain about dryness, you can also use lubricating drops as needed, no? Doc, kawawa naman yung anak ko, lalo na nung nag-start yung class, pag summer next year, ang init-init, basa na yung kanilang bumbunan, kawawa, nilalagay namin yung electric fan habang nagsuschool sila. Bawal na bawal po nakaharap sa mukha, no? Bawal na tumama sa mata yung hangin. Bakit? Kasi ang mga bata ho, hindi kumukurap. Ayaw nilang matalo sa nilalaro nila, ayaw nilang ma-miss yung pinapanood nila. So hindi yan pumipikit. So nangyayari dahil nakatama ang electric fan o aircon, yung hangin ngayon, nagtutuyo ngayon yung mga mata ng bata. Nagkakaroon ngayon ng water stains, kaya sila nagbo-blur. Kaya pag bigla niyong tinawag, pag tingala sa inyo ng mga bata, dyan sila kurap ng kurap, ikot ng mata. Kala tuloy ninyo, may nangyari na, nagkukumbulsyon na yung anak nyo. Actually, nagtutuyo lang yan. Pag nagkurap sila, nag-iikot-ikot sila ng mata, binabasa nila yung mata nila. No? And if they complain a lot about this, and if you already consulted your eye doctor, eye health professional, you can actually start putting drops on their eyes, no, to prevent the dryness. Now, like Dr. Cobillan had said a while ago, meron na po tayong law noong 2018 establishing a national vision screening program. Ngayon, katulad ng sinabi ni Dr. Leo kanina, madali lang gumawa nito kasi pwede naman tayo nung bago magpandemya, pwede natin gawin sa school too. Pero taking the visual acuity of a child, lalo ng kindergarten student, is easier said than done. Yan, katulad yan, may umiiyak, may deadma, may NR, wala lang, kurap lang ng kurap, may nagugulat, may nagsisigawan, at saka ang haba ng pila. So minsan, pag time na ng bata, kapag nasa school kayo, nag-vision screening kayo sa school, pagod na yung bata, ayaw na magbasa niya, no? Or mali-mali na yung babasahin niyan. So, paano ba tayo mag-vision screening? So again, the first one is the school-based. I got this from the Physicians for Peace site. And as you can see here, they actually actively go to the schools. They use the PERI, the Philippine Eye Research Institute vision screening tool to actually check the child's vision. But again, the problem with this is there are a lot of children waiting inside. At ngayon na pandemya, bawal na ho ito. Hindi ho natin pwedeng gawin to. Although may mga pilot programs na, pero still hindi pa rin ito magiging widespread. So, meron rin tayong mga machine-based, no, na tinatawag. Ang machine-based, ito po ay mga handheld or digital devices na pwede kumuha na ng pass or fail, kung pasado na or bagsak ang bata kapag ginawa nila ito. So ito po ay isang makina, ang tawag dito ay ang Kaleidos. Ang pangalawa naman po ay yung tinatawag natin na spot screener. So ito, ang kailangan lang po ay isang individual, either isang teacher or isang magulang na magaling or ang school nurse, tapos isa-isa papasok ang bata sa kwarto. Ang tawag ko dito, babarilin lang yung mga mata at makikita na natin kung pass or fail yung bata. Now, what are the home-based apps? So the nice thing that, again, Leo talked about a while ago was called the Go Check Kids, right? The nice thing with the Go Check Kids is this has been validated. And actually, the nice thing with this is you can actually make it, especially for the private schools that are listening here, you can actually make it in such a way that when the children or the family opens the app, they can actually choose your school, right? And then they do the test online on the phone or on their computer. And after the test is done, all the results are going to be sent to your school nurse, to an ophthalmologist who will check whether your child passes or fails. And whether your child passes or fails, this will now be sent over now to your school nurse or school doctor para ma-inform ang mga magulang na may mga batang bagsak. Para sila na lang ngayon ang pupunta sa eye health professional para magpa-check up ng mata. So ang maganda lang dito is pwede siyang specific to a certain school. So you don't want to have any problems about not having going to different doctors. No? At least ito nababantayan nyo yung mga batang nagpa-check up. Mababantayan ninyo kung nag-eye check up sila o hindi. Another thing that you can do is the peak acuity. Again, this is already being used by the WHO. But again, this one needs a individual who will be face-to-face with the child to check kasi, no? But this has a lot of other programs inside it that can be used as well. Now, a home-based or free app can be what we call the iHandbook. The iHandbook is something you can download in any of the app stores. You just go to vision testing, you do near vision test, and you do the alphabets. At pag bumagsak yung anak nyo dito, pwede niyo na ngayon papuntahin sa doktor para magpa-check up. Now, consulting during the time of the pandemic, mahirap po ngayon magtingin ng bata. Hindi ho lahat ng doktor ngayon ay nagtitingin pa rin dahil kaming mga ophthalmologists, face-to-face kami, nakadikit ang mga mata namin, ang mga mukha namin sa mukha ninyo. So, bago ho pumunta ang mga bata o mga pasyente sa clinic, usually may screening questionnaire kami, nagte-temperature check kami, may mga masks pa rin kami, maski sa mga bata, except for the very young. And then, we tape the mask when we refract. Kasi usually, hinihugot ng mga bata yun dahil nagpa-fog yung mask nila. Usually, if we need to do dilation for ROP, we do it already at home or on the road so that when they come to the clinic, they don't have to wait a long time. And ideally, one parent and one child inside the room with the rest waiting outside. We don't want too many people inside the examining room. Telemedicine, pwede ho ba namin gawin sa ophthalmology? Actually, before, ophthalmologist telehealth experience was really just a store and forward. Anong ibig sabihin? Dati kasi papagawa kami ng test sa hospital, tapos papadala namin sa doktor, tapos yung doktor ang magbabasa. And that was all we could do. And we could use telephone calls before, pero hindi namin nakikita yung mata. Gusto namin sana makita. So the nice thing now is we do have Zoom, Messenger, and all the video apps from the telemedicine health apps, and it's now nice to see the patient. So the telehealth flows chart for those that are doing telehealth would be number one, we do have a scheduling. We don't go straight to the doctor. Maraming pasyente kasi ang hiling mag-text sa doktor kagad, Doc, alas 10 na ng gabi, Doc, masakit ang mata ko. So ideally now, meron ng number na tinatawagan or tinetext ang pasyente para magpa-schedule, whether new patient, old patient, or emergency. Para malaman ngayon ng staff kung kanino bibigay. Pwede bang i-telehealth yan o kailangan magkita na kaagad sa clinic or sa ER. The history taking can be done by the staff or by the doctor. We can already do visual acuity. So again, pwede yung home-based app. No? Ancillary test, syempre kailangan pa rin gawin on-site yan. So kung hindi kailangan ng ancillary test, hindi ko po gagawin yan. And then of course, we can do an examination via video. So to do the examination via video because on a phone, I can do this. As you can see my eyes. I can see right away kung klaro siya, kung namumula siya, nagluluha siya, may muta siya. No? Makikita ko rin kapag diretso ang aking mata o nagduduling ang isang mata ng bata. Magagawa yan sa online. So at least malalaman ko na kaagad kung kailangan ko makita sa clinic right away. Pag nagmumuta, may kuliti, makikita ko rin yan online. So at least for basic exams, for basic problems, I can do this already. And again, also for trauma. Dok, ganito nangyari, anong gagawin ko? So at least masasabi ko kaagad sa pasyente kung kailangan na niyang dumiretso sa ER. So for the most common pediatric teleconsult or video consults that I do, the most common things that we can see as pediatric ophthalmologists are kuliti, sore eyes, blinking, rubbing or rolling, headaches. Usually, the common is eye check-up if refraction has changed. Naka-asterisk po ito kasi hindi ko po masasabi sa inyo kung nag-iba yung grado ninyo at mabigay yung grado sa teleconsult. Kailangan ho tayo magkita kasi nire-refract natin ang mata ninyo. Ang lazy eye, ang duling, ang banlag, makikita ko yan online pero kailangan ko pa rin kayo makita sa clinic para ma-check up ng kumpleto. Ang trauma also ay pwede ko makita online at medyo ma-assess ko kung kayang gamutin online or kung kailangan na talagang makita sa ER. Sa adult naman, pwede rin ho tayo to do this. And I think my last two slides would be to discuss lang the results of your FA for diabetes, for your fundus photo, for glaucoma, dry eye, infection, floaters, and again, trauma. The ones with asterisks, again, these are all determined by the history taking kung kailangan dumiretso sila sa hospital. And I hope you learned a lot and I will gladly answer your questions later if there are any questions. Thank you so much for listening.
Oh, thank you so much, Dr. Carlos Chua. Maraming salamat. Alam mo, ang dami mong naituro, lalo na with regards to how parents will be able to propagate eye care for their own children. Pero what strikes me most is yung salita mo, set good example. So dapat talaga magulang talaga ang magseset ng example for the proper eye care management for their children. So thank you so much, Dr. Chua, for that. And now, for our next speaker, we have Miss Lynn Abanilla. Miss Lynn Abanilla is currently the Executive Director of the Physicians for Peace. Physicians for Peace is doing great in terms of partnership with various sectors in addressing the needs of differently abled persons and population with low vision. Ma'am Lynn, the lady in pink, will talk about the private sectors and the non-government organizations programs supporting eye care services. The virtual floor is now yours, Ma'am Lynn.
Thank you, Cherry. And let me now share my screen. Am I doing this the right way? Wait. Where's my screen? MC, can you help? I can't find my screen.
Yes, Father.
Wait, a minute. There. Okay. Happy World Sight Day, everyone. And thank you for joining today's webinar, where each one of you matters to us, where everyone's presence counts. Physicians for Peace Philippines, or PFPP, continues its vision care programs and joins the National Committee for Sight Preservation and PERI, Novartis, and DOH in celebrating World Sight Day with its global challenge, Everyone Counts, and theme, Love Your Eyes. And with our ambitious national campaign, Maging Matalino, Magpa-check up now na. Let me introduce to you a little bit about Physicians for Peace. Physicians for Peace Philippines is a volunteer nonprofit organization that works on the gaps of the Philippine health system to provide access to assistive technologies, specialized surgical care, quality burn care, maternal and child care. Over the years, the Philippine government has implemented health reforms and addressed issues in health service inequality. PFPP was born out of the unmet needs with the many communities in trying to access healthcare services, one of which is our Vision Care program. We partner with the Filipino people in their aspiration to attain universal health coverage and achieve the United Nations Sustainable Development Goals, or the SDG. We are an affiliate of Physicians for Peace based in Norfolk, Virginia, and we change lives through programs and trainings and sharing the expertise of our medical doctors in various medical fields, and thus clinical care by way of helping amputees walk again, restores eyesight of nearly blind, thus preventive measures by early detection of eye impairments of children in schools, and heals the emotional and physical scars of burn victims, and provides intervention and clinical care to those who are hearing impaired. The next slide. Oh my God, what? Are we? Okay. Helen Keller once said, when we do the best we can, we never know what miracle is wrought in our life or in the life of another. My dear friends, to me, miracles come in moments. It is a miracle when you are able to gather a team of volunteers wanting to join the healthcare mission. Group of medical doctors, optometrists, ophthalmologists, therapists, It's a miracle when you are surrounded by not just the good people, but the right people to work with. It's a miracle when you see the smiles of children whose eyes you have restored. An amputee who is able to walk again with his new prosthesis, or hearing impaired patients being able to hear again. It's a miracle when you are able to touch and change lives, make them happy, and make you happy in return, and make you fulfilled, knowing we have done something good. It's a miracle knowing that the Physicians for Peace, in partnership with UNICEF, have been able to put up hubs, a one-stop hub for children with disabilities right at PGH, Eastern Medical Center in Tacloban, and have strengthened capacities at the SFPMC, or Southern Medical Center in Davao. And we hope we have to have more centers in the future. It's a miracle that Physicians for Peace Philippines get a lot of support, it be people or partners, materials or equipment, funding and grants that allows us to travel to different parts of the country and do many trips and beyond, changing lives, changing the lives of countless of thousands of people along the way, doing what we know best. Our mission is to serve the indigent Filipino individuals, regardless of their place of residence in the country. We are one with the SDG 3 on good health and well-being as we work towards attainment of health as a basic need that transcends race, religion, politics, and geography. We improve basic health care, and this is our bedrock at Physicians for Peace Philippines. We are one with SDG 4 as we work believing that quality education for all leads to empowerment. We embrace the capacity of the building effect of education, because we believe that rather than healing one person at a time, we teach others so they in turn can lead us and heal many. With the UN SDG 10, PFPP believes that we contribute in the reduction of inequalities when we deliver quality basic health services to all. And finally, with the UN SDG 1, we believe that we can all attain the goal of no poverty as we share in the work by providing one of the services we do best, and that is addressing vision impairment and reduced blindness, especially among our children. We value partnership. Collaboration makes our work possible. Through unique partnerships, Physicians for Peace mobilizes teams that responds to identified needs with expertise and flexibility. We partner with the like-minded organizations to increase efficiency and promote lasting and meaningful solutions. And respect. Respect anchors every successful relationship. We coordinate with our partners to ensure that our programs and resources align with our needs. And in every interaction, we promote consideration and dignity, and valuing diverse cultures, traditions, backgrounds, and practices. Transparency and accountability are respected in the organization. Volunteers, partners, and donors are informed how we invest and build upon their generous gifts and money. The next slide. We conduct lectures and trainings to vision screening. Physicians for Peace aims to provide quality healthcare to those patients who need surgical operation, cataract operation, prosthesis, medical consultations, with free medicines, dental services, and our beneficiaries are coursed through the assessment of the different social welfare in coordination with local government units in every place, Department of Education, and schools that we conduct our healthcare missions with them. My slides is coming in very slow. This is how we do it. Physicians for Peace deploys teams to remote areas and regions where patients have limited access to healthcare providers and resources like prescription eyeglasses. Working with local teams in multiple provinces in the Philippines, we restore the eyesight of patients and conduct surgeries to those who needed the surgery to correct congenital cataracts. Our eye care mission and eye care clinics are our ongoing efforts throughout the year. Physicians for Peace founded Seeing Clearly in 2006 to address the overwhelming need for vision care in underserved areas where more than 500,000 people are blind and many more are needy. My dear friends, look at the data that we have served. From the very beginning, in 2016 to present, we have been able to vision screen over 22,672 children and attended to adults in the number of 10,774. And 1,313 have joined our lectures, or a total of 34,759 have been served. This scope of service delivery to schools and communities is nationwide and all throughout the year. Continuous communication, coordination with partners and stakeholders facilitates systematic conduct, vision screening lectures, and training. And there were times our team got stranded in project sites due to typhoons. So the COVID-19 pandemic did not stop Physicians for Peace in reaching out to our people while observing strict health protocols with the help of the LGU units. The data that you see in the screen is a pie chart of our Seeing Clearly program that shows the shares of the services provided. And these are beyond numbers. Physicians for Peace trained volunteers and donated vision screening kits, like the Perry kits, as we call it, and sustained the awareness raising and advocacy on the eye care, vision care, especially in schools. Our trained volunteers also continued their vision screening even after the Physicians for Peace team or project team has left the site, because we believe that we share the goal that no one should be left behind. And the next screen will show you several sites in 2016 and 2020. And those are just because of the time limitations, but we have actually been around the country in many, many places, in many, many schools. Thousands of schools have been visited. So that is how we do our work at Physicians for Peace. And the next slide is my favorite, one of the favorite sayings of Helen Keller. Alone, we can do so little. Together, we can do so much. And my dear friends, let me leave you with the parting words from Mother Teresa. We know too well that what we are doing is nothing more than a drop in the ocean. But if the drop were not there, the ocean would be missing something. My friends, maging matalino, magpa-check up na now. Maraming salamat.
Oh, thank you so much, Lynn. That was really a very inspiring talk regarding collaboration with various partner organizations, and knowing we are on the same boat with Tanggal Catarata and the Lions Clubs, you know, our dream is really for vision restoration and helping out those low vision people get the much needed eyesight, no? And the word, it's a miracle. It's really a miracle working with people like us in the non-government organization.
Truly.
So thank you so much, Lynn. Thank you so much. So now our virtual floor is now open for questions. But before that, before I opened it already, there are a lot of questions that came in already, you know, that
good.
I was able to note. One question is for Dr. Leo. Dr. Leo, how important is diabetic retinopathy screening?
Ay. Dyan ba? Ayan, ayan. Good morning, and it's a very good question because when we went to several areas in the country, so we, besides checking the eye, we checked for their blood glucose. And actually, the prevalence of diabetes is around 3% for the entire population. So tatlo for every 100 people, no? And the usual na tinitingnan ng WHO would be the diabetes sa age 20 to 79. In the Philippines, around 6 to 7 people yan for every 100. And what's important to note is that in 100 people na may diabetes na nakita natin sa survey, and actually in most surveys also in other parts of the world, around 60 lang would know that they have diabetes. Actually 40, in the Philippines, ito yung data natin, 40%. Some have 50%, other countries, tayo 40%. It's their first time to know that they have diabetes. So that's why it's important for them to be screened kasi 10%, no, sa lahat ng mga may diabetes ay may diabetic retinopathy. So that's why they have to be screened. The moment they are diagnosed, they have to be screened to prevent blindness among these. And unfortunately, when you see these patients, imagine yung 40, they have no symptoms. No? They have no symptoms. They don't know they have the disease. Kaya that's why it's very important to have a screening program. Yung minention ko kanina na artificial intelligence that we are working on, it's still under study, no? So hopefully, pag natapos yun after, I think 1 to 2 more years, no, we'll be able to give a solution to the country. Thank you, thank you.
Okay, thank you so much, Dr. Leo. Sana yung nagpadala ng question, na-satisfy ng gusto ni Dr. Leo yung kanyang tanong. Now, a question for Dr. Carlos Chua. What happens if we do not follow the screen time guidelines? Will their child's grade get worse if they are online all the time?
Well, actually, naman, it won't actually get worse. It really depends. No? When we talk about myopia, actually that can be a little bit of a problem. Too much of the screen time can actually increase just your accommodation, could increase your prescription a little bit more. But too much screen time will actually damage the eyes in terms of causing dry eye and digital eye strain. Hindi ho mag-iiba yung grado ng mata, kundi yung pakiramdam ng mata ng bata dahil masyado silang nakatingin sa screen. So yun po ang take away dyan. Hindi ho tataas ang grado ng mga anak ninyo. Ang mangyayari po sa sakit, iikot-ikot yung mata, kukurap-kurap sila, kusot sila ng kusot dahil nasosobrahan ng screen time.
Okay, so palagay ko naman nasagot na mabuti, no? And we have also a question here for Dr. Cadil Sinulinding. Sabi dito, how do you marry both developmental work as an ophthalmologist and a nutrition advocate?
Nutrition and blindness is interrelated or closely related.
With proper nutrition, we can always have a very good eyesight. But beyond the care of nutrition, there goes the surgeon that takes the lead. Sa atin po dito sa rehiyon, sa Bangsamoro, ito na yata yung rehiyon na wala ng katapusan ang problema na ating hinaharap. Ngunit tulad din po ng ating history, the Bangsamoro people does not go out of the fight. We always fight at kami po ay palaging lumalaban sa hamon ng buhay. Kaya yung mga kasamahan nating mga workers dito, mga health workers, lalong-lalo na yung mga eye doctors natin, na kung titingnan ko po wawalo lang kami dito sa buong rehiyon, covering more or less 4.5 million Filipinos. Pero laban, kaya nga po Ma'am Cherry at sa lahat ng ating participants, pag pinag-usapan po ang paninilbihan, wala namang boundary yan. Kinutrisyon, service provision by an ophthalmologist, or by an ordinary physician. Ang importante po talaga, nasa ating puso yung ating gustong mangyari. Salamat, Ma'am Chair.
You're most welcome. At ayan, kayang-kaya ni Doc Jojo pagsabayin yan. At interrelated naman sila. Okay. So meron ding question dito para kay Ma'am Lynn. Sabi niya, as a non-government organization, how do you expand your reach as far as Vision Care program is concerned?
Thank you, Cherry, for the question. Actually, mayroong kasabihan, it takes a village, di ba? So sa amin sa Physicians for Peace, kailangan namin ang partners, kailangan namin ang optometrists and ophthalmologists and other allied services. Kailangan namin ang grants. Kailangan namin ang LGUs, kailangan namin ang barangay health workers because we need a lot of people to conduct this kind of services. So it takes a village to do this. So that's why we value our partners. And collaboration to us is a very important work that we do. And respect and transparency and accountability. I may have missed that earlier, pero alam mo, ang partners namin talagang we inform them. We always inform them on how we invest and build upon their gifts or their money and their time. So yun yung kaya kami nakaka-expand ng reach. The reason why we're able to go around many trips around the country is because we're so privileged and lucky to have very good partners and very good working relationship with our volunteers. So it's a volunteer-oriented organization. So that's the only way I think we can expand the reach.
Okay. Thank you so much, Lynn, for that very apaka-informative. Ang dami talagang pwede pang tumulong dyan. Pero meron pang ano dito. Sabi dito, singit question daw. Kasi ang galing daw lahat ng mga speakers and gusto raw nila lahat ng pinag-usapan. But Dr. Jojo, meron silang tanong dito.
Yes,
Sabi
ma'am.
niya, pandemic now, paano ang eye missions? Kamusta naman ang CSR?
Okay. Sa totoo lang po ma'am, tulad ng sinabi ko, if the mountain cannot come to Muhammad, peace be upon him, then we will go to the mountain. So it's just a reciprocal process. Pero tulad po nung ginagawa natin ma'am, medyo stricto po yung ating pagpapatupad ng mga eye missions. Tuloy-tuloy po yung ating pero nga po, mayroon na tayong swab test para sa lahat ng ating mga inooperahan at very strict po yung paggagamit ng face mask, face shield, doon sa screening area. Except na po, pag nag-examine, binababa po yan siya. Tulad ng ginagawa ni Dr. Chuba, natuloy po yung kanilang visitation, ganun din po yung sa atin. We restricted our visit doon sa mga matataas ang rate ng COVID-19 rate nila. Pero po sa mga areas na mababa naman, then doon po tayo pumupunta. At doon tayo sa mga smaller population na kung saan ang tinutukoy lang po natin ay yung may problema at may kapansanan sa mata. So we don't cater any other problems muna except lang talaga yung mga may problema sa paningin at saka sa kanilang mga mata. So medyo medyo mapili tayo this time and it is because COVID-19. Sana po pag lumipas na ito, mag-new normal na tayo. then we will go back again at magkikita naman tayo dyan sa Luzon. As usual.
Oo. Sasamahan mo ko ulit. Hindi mo ako pwedeng
Yes.
pabayaan. Thank you so much.
Yes
Thank you.
na yes.
Ay, ang dami pong papuri na natanggap namin galing sa ating mga participants ngayong umaga. Ang gagaling daw ng speakers. I salute everybody. Totoo naman yun. Talagang mahuhusay and very informative naman po. Ang dami po naming natutunan, sabi dito. Ang dami po namin natutunan ngayong umaga. Saludo po kami sa inyo. You are really genuine eye health workers. Thank you so much, sabi dito. Okay, pero bago tayo lumawig at magkatapusan, we have to have our photo ops muna. Picture muna
Okay.
tayo para for posterity, okay? Oh, who would take care of that? Would Perry take care of the pagkuha ng pictures?
Yes, ma'am.
Sige.
Everyone, please open your cameras.
Bakit wala sa akin?
Yeah, we'll wait po.
Wala sa
May we request Dr. Noel, Dr. Jojo, to open your cameras po. Ma'am Christine, medyo madilim po kayo, ma'am. Yan. Waiting po. Saglit lang po. Doc Noel. Sino pa po hinihintay? Si Doc Noel po.
With over 200 participants, it will be a
Ayan.
while.
Ay, saglit lang po. Actually, ma'am, ang makikita lang po dito is yung panelists. So, Sir MC, makikita ba tayo dito? Ang participants? Anyways,
Panelist lang.
hindi po. Panelist lang. Yan. So, for the panelists, ayan, dyan na si Doc Noel. Sige po. Smile po tayo. 1, 2, 3. Ayan. Isa pa po. 1, 2, 3, smile. Ayan. Thank you, everyone.
Thank you.
Okay, di ba?
Thank you,
Thank you,
Athena.
Photo
everyone.
shoots muna.
Thank you, everyone.
Okay. So, after the enlightening talks from our guest speakers for this morning, we will now call on the representatives of partners, NCSP partners, for their short comments of commitments and support for the World Sight Day 2021. And please, may we request to please open your videos for this? Can Athena help me out at this point in
Yes,
time?
ma'am. Okay.
Okay, thank you.
Thank you po. Thank you, Ma'am Cherry. So, first of all, we will show the slide from the DOH where it promotes and encourages consultation with the primary providers with the tagline, Consult Tayo, which is part of their program Healthy Pilipinas. They are relaunching it today in time for the World Sight Day 2021. Yes, the National Committee for Sight Preservation member organization supports the World Sight Day 21. First off, we have, next slide, please. First off, we have Mr. Danny Haddad, Inclusive Eye Health Director of CBM Global. Christian Blind Mission supports the World Sight Day 2021 with its theme, Love Your Eyes, and we are joining its global challenge, Everyone Counts. For CBM Global Disability Inclusion, the statement, Everyone Counts, is at the core of what we do. Our inclusive eye health program seeks to ensure we create access to eye health for everyone, removing the figurative barriers that are in place. We therefore also focus on the continuum of care, ensuring that those that have irreparable vision loss get the support that they need. This World Sight Day is therefore a good moment to love our eyes, but also to realize we need to take an effort within ourselves and not forget that this is not as natural as it is. Next, we have, next slide, please.
Amid this pandemic,
We have Ms. Rebi Relator, Executive Director of the iHear Foundation, Incorporated.
This World Sight Day, we pledge to continue reaching the unreached, doing surgeries for those who have been living in the dark. We pledge to continue screening the school children, the kindergarten, especially conducting outreach services. Together with all our passionate staff, we pledge total commitment in restoring more sight. Love your eyes.
As soon as we get the chance,
We have Dr. Maria Victoria Rendaris of Country Manager, Fred Hallows
everyone
Foundation.
to love their eyes by visiting your nearest eye doctor. We are seeing the light at the end of the tunnel. Hopefully, our vision is still clear by the time the pandemic is over. From the Fred Hallows Foundation, this is your country manager, Dr. Mavi Rondaris, wishing everybody happy World Sight Day. Have your eyes checked.
Dr. Maria Fatima Dolly Riario, Senior Programs Manager, Helen Keller International Philippines. The Helen Keller supports the World Sight Day 2021 with its theme, Love Your Eyes, and we are joining in Global Challenge, Everyone Counts. Globally, Helen Keller International is continuously working to fight the causes and consequences of vision loss and helping to make clear vision a reality to people that are vulnerable to diseases and those who lack access to eye care. With this year's World Sight Day theme of Love Your Eyes, HKI enjoins for more Filipinos to become more aware of their own eye health and take the necessary task of getting an annual eye screenings and encouraging others to do the same. Next slide, please.
Good morning, everyone. As we celebrate today, our worst congratulations and thanks to our stakeholders, partners, our resource speakers for sharing their time, effort, expertise regarding sight preservation, awareness, and taking care of our eyes. To our fellow Lions, Leos, let's support and even campaign to encourage everyone to have their eye care checkup regularly. Lastly, let's stand together. Let's start another great year of service from our heart ahead of us. Roar, roar, roar!
Mr. Valentin Tio, Grant Administrator, Sight for Kids Project. The Sight for Kids Project supports the World Sight Day 2021 with its theme, Love Your Eyes, and we are joining its global challenge, Everyone Counts. Next slide, please. Dr. Leo D.P. Cobillan, Director of the Philippine Eye Research Institute. The Philippine Eye Research Institute supports the World Sight Day 2021 with its theme, Love Your Eyes, and we are joining its global challenge, Everyone Counts. Next slide. Ms. Lynn Abanilla, Executive Director of the Physicians for Peace Philippines. The Physicians for Peace Philippines support the World Sight Day 2021 with its theme, Love Your Eyes, and we are joining its global challenge, Everyone Counts.
The Philippine Society of Public Health and
Dr. Mildred Pre, President of the Philippine Society of Public Health and Occupational Optometry,
and those who value good vision to take part in this year's World Sight Day celebration. Let us spread the word about the importance of eye health and why everyone should pledge to love your eyes. Everyone counts.
For this World Sight Day celebration
C., Chairman of
2021
Tangat Foundation,
and the coming celebrations in the years to come, Be rest assured of Tanggal Catarata Foundation's cooperation and support to its advocacy and commitment in eye care. We will be there at your back.
Thank you to all our partners for all your continued support and commitment for the World Sight Day and preserving the eye care. And let's all go back to Mom Cherry for the closing remarks.
Yeah, thank you so much, Athena, for helping out with the statement of commitments from our partner organizations. Of course, we will now come to a close, but we will be welcoming Miss Christine Fajardo. Thank you for the support of Novartis to the National Committee for Sight Preservation on the partnership to preserve sight project. We look forward to future endeavors. Miss Christine Fajardo, please take the virtual floor now. Thank you.
Thank you, Cherry. Good morning, everyone. Thank you very much for joining us today and supporting this year's celebration of World Sight Day with the theme Love Your Eyes and the challenge, a global challenge, everyone counts. Novartis and our collaboration to preserve sight partners, the Fred Hallows Foundation, Vitreoretina Society of the Philippines, National Committee for Sight Preservation, and Perdami Indonesia are working together to reimagine eye care in the Philippines, Vietnam, and Indonesia amid the COVID-19 pandemic. Over 7 million people in the Philippines, Vietnam, and Indonesia of all age groups have conditions affecting the front and back of the eye. Many cases of blindness in these countries are preventable through screening and timely eye care. Unfortunately, the 3 countries are at the bottom of the latest Bloomberg COVID resilience ranking. Health-seeking behavior suffered as eye clinic visits declined during the pandemic. The challenge we face is to reimagine eye care through vision screening and ensure patients get treatment despite the pandemic. And so I thank all our esteemed panelists for their support in this endeavor. The preliminary results of our work are encouraging. You have here on screen the Philippine results. Allow me to verbalize the results to date from the 3 countries. We have reached 1 million people through awareness initiatives. We have screened 78,000 patients. We detected vision impairment among 11,000 patients. And we have facilitated 7 out of 10 diagnosed patients to seek consultation. Also, there is a treatment of 6 of 10 patients or over 4,700 patients. We launched social media platforms for patient education and screening schedules. One is the Maging Matalino Facebook. And we have formed external partnerships with over 370 patient and medical organizations, NGOs, and policymakers. 370 partnerships, and I agree with Mom Lynn about we do this together, we work together. In closing, Novartis is privileged to support our partners who share our goal of promoting awareness on vision impairment and reimagining eye care during the pandemic. Please visit the Maging Matalino Facebook page. We encourage all Filipinos to become active participants in their eye health journey by having their sight tested. Maraming salamat po and happy World Sight Day.
Thank you so much, Miss Christine, and we hope that you would continuously help out the National Committee for Sight Preservation for its advocacy regarding eye health and restoration of sight. So, wish to thank everyone who participated in this webinar for this morning.
What if
my special thanks to our Lions family. Thank you so much, Council Chairperson Faustino Yuson and all the other incumbent district governors who are present here, the past district governors, all our fellow Lions, thank you so much with our loudest roar. So in closing, let us be counted and continue with passion and mission to address the eye health challenges. Remember, let us love our eyes and recommend others to do the same. So, isang muli pong napaka-magandang umaga and happy World Sight Day, everyone!
Happy World Sight Day din po. Thank you everyone.
Hi everyone.
Ma'am
Please
Cherry,
stay
congratulations. Doc Showa, Doc Noel, Sir Noel, Ma'am Lynn.
There's a
At
video
saka
pa.
Leo.
Thank you sa inyong lahat.
There's
Congratulations
a
sa inyo
video
lahat.
pa.
Excuse me po. Ayan. So please, everyone, please stay because we have prepared a small surprise. Although, pandemic ngayon, we would like to give a positive
What if we
note,
told you
and we are
that you would
showing you
never
a
see another
pre-Christmas carol.
sunset? What if we told you that watching the waves rise and fall would be nothing more than a memory? What if we told you that the light at the end of the tunnel would never come? Over 2 million people suffer from vision impairment in the Philippines. More than 300,000 adults and 25,000 children are blind in Vietnam. 3.5 million people suffer from blindness in Indonesia. Every minute, one person goes blind. Novartis' mission is reimagining the treatment and prevention of vision impairment and avoidable blindness. And so, we came together and asked ourselves, what could we do to help people open their eyes to a better tomorrow?
We set out to reimagine eye health for people across the globe, to create a world where everyone has access to the treatment solutions they need to preserve their sight.
Novartis and the Fred Hollows Foundation joined hands to raise awareness and conduct vision screening in the Philippines and Vietnam.
We pledge to omit eye screening gaps in the country and strengthen our commitment to the global elimination for avoidable blindness, Vision 2020, the right to sight.
The Fred Hollows Foundation set up a wide-range blindness prevention network so that every patient can have access to high-quality eye care services in their area.
We strived and continue to do so to enhance capability and infrastructure around eye care in Vietnam.
We are working with the Fred Hollows Foundation to improve eye health services for the public.
We perform eye screenings for 10,000 patients across Indonesia and educated public on blindness prevention from diabetes.
More than half of cases are avoidable. And together, we're looking to ensure that people never lose sight of the things they love.
Together, let's find the solutions to ensure that everyone, everywhere, has access to eye health care. Let's pledge to spread the message of hope in sight. Your vision, our mission.
Wow, so that's so nice. Again, my reminder, please like and subscribe to Maging Matalino FB page. And please share this to your family and friends. Again, a pleasant morning to all.
May presentation
Magandang
pa
World Sight
Perry.
Day.
May presentation pa Perry.
Meron pa ang Perry. O sige,
Yeah.
go ahead. Go ahead,
Hey
Perry,
everyone,
please.
please stay because we have prepared a small surprise. Although pandemic ngayon, we would like to give a positive note, and we are showing you a pre-Christmas carol from all the staff of Philippine Eye Research Institute. Advance Merry Christmas, everyone. Hope you'll enjoy it.
Sige.
Bumubuti-buti ka, bumubusi-busi ka, ganyan ang pananaw ng mga bituin.
tumitibok-tibok, sumisinog-sinog, unahan katarang bituin.
Nagdadagang palatuloy, aking isang sa puno.
Buhusan ang mga kulay, tambakan ng mga regalo. Sumisinok-sinok ang panundok sasabihin. Lupot-lupot, paikot na paikot, unahan ang parang bituin. Dagdagan mo pa ng candy, Ibon, Escocesa at Kumitan, ang lalong lumaki, regalo mo'y dagdagan. Tumitibok-tibok, sumisinok-sinok, huwag lang malundok sasabihin. Lupot-lupot, paikot na paikot, unahan ang parang bituin. Dagdagan mo pa ng candy, Ibon, Escocesa, Kumitan, habang lalong dumadami, regalo mo'y dagdagan. Umumusik-musila, ganyan ang urat ng mahalipin. Tumitibok-tibok, sumisinok-sinok, unahan
Thank you and Merry Christmas.
Ganda.
Saan ang regalo ko?
Thank you.
Namamas ko po. Regalo.
Namamas ko po.
Thank you,
Namamas ko po.
everyone.
Thank you, Doc Leo.
Thank you, everyone.
Congratulations, everybody. Ang gagaling,
Yeah.
ang gagaling natin.
Okay,
Ang
bye-bye.
galing.
Ingat po
Thank you,
kayo.
everyone.
Salamat sa inyo, ah.
Until next
Congratulations,
time.
Doc Leo.
Thank
Ang
you,
daming
thank you,
pagod
thank you.
niyan. Ang dami mong pagod dyan. Doc Duvel,
Thank you, Cherry,
so much.
for taking care of the
Hindi naman
program.
halata sa inyo, ang gaganda at guwapo pa rin lahat.
Mm-mm. Basta para kay Lynn,
Salamat
okay lang
ulit.
ako magbihis ng pink.
Dalawa tayong naka-pink.
Sabi mo, usapan yan eh, oh, di ba? I have to
Oo.
change. Salamat ah.
Thank you,
Thank you, Ellen.
everyone.
Thanks.
Ito sa
Bye.
fun-filled morning.